Blood gas sample collection and proper handling. This is an instructional video about how to collect a capillary blood gas sample. Follow your local hospital procedures to prepare the patient and collection site for obtaining the blood sample. Collecting arterialized capillary blood may be an alternative to arterial blood collection, particularly in infants. The most typical site for capillary collection in infants is the lateral or medial plantar surface of the heel. However, the tip of the big toe, fingers, and earlobe may also be used. Blood gas analysis is performed to test vitals in critically ill patients. Blood gas analysis gives information on gases and may also include electrolytes, metabolites, total hemoglobin, co-oximetry, and neonatal bilirubin. In theory, blood gas values obtained from a capillary draw approximate arterial values. However, typically the PO2 values obtained with capillary samples may be lower. Please ensure you have all the materials you need to draw a patient sample. This includes a capillary tube, the capillary caps, a lancet, an alcohol wipe, gauze, and bandage. The capillary used for blood gas analysis should include dry, electrolyte-balanced lithium heparin as the preferred anticoagulant. Before performing the capillary draw, confirm the patient's identity. To arterialize the puncture site, warm the skin to a temperature of approximately 42 degrees Celsius. Clean the puncture site. Do not use a skin cleaning wipe that contains quaternary ammonium substance, such as benzalkonium, as it may affect the electrolyte parameters reported, particularly sodium. Let it dry. Puncture the skin with a disposable lancet to a depth no greater than 2.0 millimeters. Wipe away the first droplet of blood. Place the tip of the capillary sampling device in the center of the blood droplet and allow to fill the capillary as rapidly as possible without air bubbles. Fill the capillary tube completely with blood that contains no air bubbles. Seal both ends of the capillary with the capillary caps. Apply pressure to the collection site and bandage the heel. Mix the sample thoroughly by rotating your wrist back and forth for a minimum of 20 seconds. This helps to dissolve the heparin and minimize clot formation in the capillary. Label the capillary with the patient ID, and immediately transport the capillary to a Siemens Healthineers blood gas system. Follow a two-step mixing process, first by rotating your wrist back and forth, and then rolling the capillary between your fingers about 10 times. Remove the caps from the capillary. Do not expel any blood onto a gauze pad to ensure sufficient sample volume for analysis. Present the capillary sample to the analyzer and start analysis. Recognize that a sample containing blood clots should not be used on the blood gas analyzer because it can affect not only the accuracy of the patient results, but also negatively impact the operation of the blood gas analyzer. The patient's blood gas results will be ready within 60 seconds. According to the CLSI guidelines, blood gas testing should be completed within 10 minutes and not longer than 30 minutes after drawing the sample. Remove the capillary from the analyzer and discard the capillary according to hospital guidelines. Proper sample handling, mixing, and time to analysis helps to ensure accurate patient results.